Hi YouTube, this is Teddy Bear over here at the Brushbeater.store behind the medical counter. Matt has once again stepped out and he still doesn't know that I'm doing these, so don't tell him. He doesn't know that I'm sleeping back here. Um, but what I want to talk to you about is paperwork, which everyone loves, and I've got a little homework assignment for you if you care to choose if you care to do it. Um, we've been talking about pre-hospital trauma, trying to do kind of the civilian side, or just anybody stuck in a bad situation, borrowing off of what the military developed for their um trauma care in the field. Anything called that is pre-hospital trauma. So I've got some different forms for you. I've just got them here in front of me. I don't expect you to be able to read them from here, and we'll get them popped up in post. That magic will happen somehow. Not my area. First thing I want to talk to you about is the Tactical Combat Casualty card, or the TCCC card, also called the DD Form 1380, Department of Defense Form 1380. And what it is a way to document with the casualty's injuries and what you've done with the casualty, and then you can hand that casualty off to hopefully a big beautiful helicopter or a big beautiful ambulance or somebody with a higher level of care or just more resources to take care of that patient. I can say on the civilian side, medicine, transfer of care, even if somebody's in a hospital and they're stable and everything's great, medical errors are the most likely when you've got a handoff. You've got one team's been there 12 hours or so taking care of those patients, and they're handing off to the other team, the day team, the night team, whichever it is, and they're going to be taking care of that patient for 12 hours. That communication interface is where most errors happen. So we got to be really careful, and we're going to try to have as much standardization as possible so everybody's literally on the same page. So the TCCC card is very helpful for us. It's very much geared to the military, so there's some things that may not be exactly relevant, like serial numbers or rank or whatever. It's like, oh, is this person a U.S. U.S. military, foreign military, enemy, whatever. Maybe not relevant if you're in the middle of a mass casualty because a shooting event or a natural disaster, but it's fairly useful. It has built into it this little diagram of the human in anatomic position, and that's just to mark where injuries are, what if you put tourniquets, you can kind of document that, as well as burn area. You can use that for estimating about how much of their body surface area is burned, which is very relevant to the follow-on care, because the more you get of a full thickness burn, the more you're going to start losing fluid, and then they're going to have to start trying to fill a leaky bucket, and that's just part of post-burn care. So not really your concern, you just want to try and document it as thoroughly as possible. On the back, or the second page of the TCCC card, is what's called just essentially treatments. What this is built around, the TCCC card, so treatments is whether you put it in an NPA, whether you give them oxygen, chest tube, some of these things that are really outside of the private citizen, first responder kind of thing. We're not expecting anybody to do injections or just have medicine with them, and there's a whole lot of liability with that in the civilian context. So it is still a good rubric. So the TCCC card is built around something called the MIST report, and you can see it built and written there into the TCCC card if you have it pulled up. MIST is M-I-S-T, like the old video game. Yes, I am that old. Mechanism of injury for M. I is injury. Why do we care? Why wasn't just call it injury? Well, was this an RPG? Was it shrapnel? Was it a bullet wound? Was it a motor vehicle accident? We want to know those things because we may be looking at this injury, but there may be associated injuries with it. In the military context, sometimes if you had like, hey, they want to record if this person was injured with an RPG or an IED or something novel like that, because we now have that kind of injury pattern in this area of this part of our area of operations. That's more military intelligence side of things, which is not my bailiwick. So mechanism of injury, signs and symptoms. So you're looking at their vitals, you're looking at their pain scale, you're looking at their level of aware of consciousness, like we talked about with AVPU, AVPU. Sounds funny, but look it up. We talked about that last time. Then T of mist is treatment, so that could be everything from your tourniquets to putting a needle D in their chest to giving them meds, all that stuff. So that's the mist report. And it's also printed out over here. So the T-C card is built around that. You can expand out the mist report in a more of a civilian context. You can put in their age, their sex, medical history, relevant medical history. So if you've got somebody with a history of they've had open heart surgery and they're talking about chest pain, well, most likely that's very relevant information. If they are bleeding and you have the information that they're on blood thinners, that's also very relevant information. So that's the mist report. It's kind of a short and sweet way of looking at it when you just need to really convey the most important information very quickly. And my friend Mech Medic did a write-up on this over at American Partisan. You search Mech Medic, you search mist report, and the handoff, tactical evacuation, the handoff. He's got a two-part write-up over there. So last thing I want to talk to you about, wave top here, is what's called the 9-line medevac request. When I say 9-line, you probably think of a t-shirt company. That is because 9-line, the t-shirt company, is, you also see stickers in the back of cars. It was started by a pilot from the 160th SOAR, or Special Operations Aviation Regiment. They are the Delta Force of pilots. And what they do is a whole lot of medical evacuation in places that no one would want to go to medically evacuate. So they're very best at what they do, and he started a t-shirt company, like many veterans did. So that's probably where you've heard the 9-line. It literally has 9 lines to it, and it's an abbreviated way to tell the big beautiful helicopter, or big beautiful truck, whatever it was, those people that are going to come take your casualty off your hands, kind of what to expect. It's abbreviated. I really encourage you to look it up. We'll put it up on the screen as well. And basically it just has a form of pro words. If you remember from the movie Black Hawk Down, they had the go word of Irene. Irene was the pro word for, we're going to start the mission. So pro word is just a pre-designated word or letter that means something that's already been identified. On the 9-line, they have, for example, in line 2, A is urgent, B is urgent surgical, which you could just put those together, C is priority, and D is routine. So when you're filling this out, let's say you've taken RTO, advanced RTO, and you're using a tablet and you're bursting out data, you can just write out a series of letters instead of writing a small novel for your medical report when you're requesting an evacuation. There's issues that get into that with signaling. That's very much written to the military, very much dating back to the Cold War. It's part of why they're using pro words. When it gets into kind of that near-far recognition symbols, where you're getting into, I flash this number of flashlights, or I use smoke, or I use a flare, IR laser, whatever it is. What the specific thing is not important. It's what's most important is that you have that agreed upon with whoever's coming to get you if you are in a contested environment. If you're in a civilian environment, they probably just need to be on your cell phone talking to the dispatcher saying like, yeah, I'm the guy in the camo ball cap with the black Kyber Optics t-shirt, big says KO on it. And yeah, check out Kyber Optics too. Maybe you can save yourself some money on some optics and you can buy more medical gear. Anyway, until next time, this is Teddy Bear, out.